Good morning, everybody. I'm going to call this joint meeting of the Health and Human Services and Veterans Committee to order. I'd like to welcome all of you that are here, and we are going to start by standing and doing the Pledge of Allegiance, and I would ask Mr. Van Landuit to lead us in that. Thank you. Okay, I believe we have proof of notification. I know it was emailed out and it was posted. All right, I would take a motion then to approve our 25-point agenda. Mr. Gotchell, and second by Mr. Van Landuit. All those in favor, please say aye. Opposed? Okay. I hope you all had a chance to review our last meeting's minutes. There was a lot of information contained in there. So were there any corrections or amendments to that? Welcome, Mr. Seat. All right, if not, then I would take a motion for an approval of our last meeting's agenda. I mean, not agenda, minutes.
I move.
Mr. Severson moves. Can I have a second? Second by Dr. Barris. All those in favor, please say aye.
Aye.
Aye. Any opposed? Okay, this takes us to our public comment portion of the meeting. I want to again welcome all of you here. I appreciate you guys coming and sharing. We definitely value the public's views and comments and input into the important decisions that are being made right now, not only in this committee, but across the county. We do have a lot of decisions to make today and a very long agenda. So in interest of making sure that all of you are able to speak if you want to share, and in keeping with our last meeting, I would ask that you keep your comments to 2 minutes or less if possible, please, and also sign in if you do wish to speak. I'm going to start by going down the list of who I have and calling them to the podium to speak. And then if we get more on a list, we can address that at the end. So the first person that I have on the list is a Pam. I'm sorry, I'm not sure if I can read your last name correct, but Pam? Oh, that's okay. Welcome.
My name is Pam Colbert. I'm a chip, which is Chicken Ridge. So I'm a resident of Dayton Township on Chicken Ridge Road. I help my neighbors a lot in kind of reminding them of the services this county does have when I see people struggling. So people who need transportation, not sure how to get to medical appointments, people who are worried about their insurance and their benefits. So I really feel that a lot of the services of the county are needed because we have an elderly population. Many of the people in my neighborhood are elderly. I see statistics that 30% of our county is elderly, but also in my role, I'm a dementia care specialist. I work with people who live in the community because 70% of people with dementia live in the community. They are not in long-term care facilities. So I see a lot of struggling caregivers. I'm trying to maintain people at home as long as possible because sometimes it's a disease that takes 10 to 15 years. So people are living at home. And those services like home delivered meals, adult protective services, caregiver funds are some of the things that keep them going. And so I think people need to realize that a lot of things have happened with the pandemic. We became really aware of how much isolation and loneliness affect not only people's mental health, but their resiliency and their health outcomes. And so these things like home delivered meals are not just about food. I'm constantly telling caregivers that if you sign up for those home delivered meals, that's another set of eyes in the home, because I work with caregivers that sometimes live at a long distance from the person they care for. And so those things that we do, like transportation, that's sometimes the only person they've seen that day to check on them. If there's been somebody who has, say, COVID, and they don't call their family or they don't have family to call, those home delivered meals are the ones that identify or those. So I really think that if we want to save the county money, we really need to look at those things that help make the county cost effective, which is like the nutrition program, the ADRC, those kinds of things. So I would like us to look at these services not for just the focus, the intention that they were done, but the impact they have in other ways in kind of keeping tabs on the elderly that do live in our community, as well as the disabled. Thank you.
Thank you for sharing. All right, next I have a Sandra Kramer.
Good morning. I'm Sandra Kramer, and I agree with her opinion. The one thing I want to talk about is the ADRC. I am a caregiver for my mother who has dementia. Unfortunately, because of the lack of funding, my mom lives 5 miles outside of the radius of a home-delivered meal. She will not take the frozen meals because she looks at it like, well, if I'm going to take a frozen meal, I just will have you get me a frozen dinner from Walmart. And she has a hard time dealing with taking the plastic off and that type of stuff. So I think there needs to be more funding for the nutrition program so people that are over the age of 65 can receive nutritional meals. And again, another eye that comes into the home to see if they're abused, if they're self-abused, and if they're well. The other thing too is that ADRC, they work with Simons. They work with Simons in programs like the prevention of falls for the elderly, body strengthening and balance, so these people can stay at home. They have the High Chi program, which is wonderful. It also helps with high blood pressure. They have programs for the caregivers like myself and how to deal with dementia. And there's a lot of things. Our county, unfortunately, is getting older. And right now, individuals over 65 that are living in poverty is 15.1%. And individuals over 60 is their income is under $25,000 per year. So, and then you have the young people who individuals are 18 to 64 with a disability is 1,111, which is 10.1% of the county. So we're not talking just about people who are old and walk with canes and wheelchairs and walkers. We're also talking about the younger generation as well that needs these type of programs. Thank you.
Thank you. Becky Dahl. And next will be Larry Engel.
Good morning. Thank you for this opportunity. I would like to speak on how staff, services, and supports provided by Health and Human Services is here for all of us. It is a warm and welcoming place to go when members of our community need support to be healthy, to be a caregiver of an older adult with dementia or a child with disabilities, or after a life-changing traumatic accident, a terminal illness, or mental health issues that hurt worse than a broken leg. My name is Becky Dahl. I have worked as a social worker for 40 years, retired now, 30 of those here in my hometown. My career has given me the opportunity to work in and with all services of the Health and Human Services, the last 10 years as the regional director of the ADRC of Eagle Country. A bit of data. In 2021, the ADRC saved taxpayers $4.56 for every grant dollar. People working with the ADRC are 22% less likely to be readmitted to the hospital. 36% of our population are over 60 and or living with a disability, and a large number of those living in or near poverty. I was shocked to recently learn 65% of the children in Richland School District are eligible for free and reduced lunch programs. The Children and Youth Services Unit is here to support families whose child is now experiencing behavioral mental health issues. Their work is about keeping families together, preventing expensive out-of-home placements. It is about advocating for a child when no one else is there to keep them safe. All units in Health and Human Services work closely with the Behavioral Health Unit, as mental health is the first place to start to maintain things that are valued by all of us, keeping our families together, maintaining employment, our physical health, seeking joy to our day. Quality trained staff is what keeps people out of expensive institutional placements. Health and Human Services is not about giving handouts. It's about giving people a hand up. Our goal is to walk beside people till they can lead, and then to walk behind till they no longer need us. This is prevention. This is all of Health and Human Services staff working together to give families, individuals a hand up when they are facing unexpected challenges. Reducing staff, programs, and services at Health and Human Services will reduce our work in prevention and ultimately increase our out-of-home placements institutional costs. Thank you.
Thank you. Have Larry next, and after Larry will be Marge Freeman.
Good morning. I serve as the pastor of Five Points Lutheran Church, and I'm also a member of the county's Commission on Aging and Disability. In these fiscally challenging times, the challenges that face the county board are not easy ones. This week, I searched for a mission statement for the Richland County Board as I wanted to see if I could find a sentence or phrase that could serve as a bedrock ethical guide in decision-making. What I found was the Richland County Health and Human Services mission statement. I didn't find one for the county as a whole. I did find the Health and Human Services one was pretty crystal clear. The county is to promote the health, well-being, and self-sufficiency of all the people in Richland County. I thought that was a great ethical guide. The county is to promote the health, well-being, and self-sufficiency of all the people in the county. From a faith perspective, our religious traditions embrace that mission, and we'd recommend the addition of the words common good. Because the phrase common good is defined as the sum total of all conditions where each and every human being in the earth can flourish to the best of their abilities, especially the most vulnerable in our society. So the common good is a biblical teaching, and we find it to be a bedrock ethical guide when making difficult ethical decisions. It's something to keep coming back to, circle back to. A special concern for the Aging and Disability Commission are the 6,273 individuals that are aging or disabled in the county, 36% of the county population. 15.1% of those senior citizens have income below the poverty rate, and 30% have income of less than $25,000 a year. Our seniors are vulnerable and marginalized. So when making decisions about programming for seniors, we find the common good is a wonderful guide. What's the best decision that will create the conditions where each and every person can flourish, especially the most vulnerable? Thank you.
Thank you. Have Marge next, and then after Marge will be a Bill Anderson.
Good morning. My name is Marge Freeman, veteran, and also the commander of VFW Post 2267. My question is to the county chair and also to the Health and Human Services representative. I've been looking at the ad hoc committee notes in reference to the HHS employees. It's the three main concerns to many of us are there's 9 showing under administration, there's 4 under finance, but 25 under mental health care. Now, the mental health care gets a lot of attention to individuals. Now, from what I understand, there is 1 psychiatric care doctor that does telehealth through Richland County and HHS. I would like to know, many of us would like to know the detail, what falls under mental health care. And those employees that are employed, what exactly is their job descriptions? Because when it mentions mental health care, that's a broad sense. And what is the detail for that? That's pretty much on the September 26th and the October 8th ad hoc committee. So I would like, if that could be explained further detail. And that's all I have for today. Thank you.
Thank you. Mr. Anderson?
Good morning. I'm Bill Anderson from Southwest Ithaca Township, lifelong county resident, mostly, some times working other places. I want to comment on how important food program is for so many of us seniors that have mostly lived here most of our lives. And there's a lot of individuals that are very isolated or live alone. The meal they get is very important. It may be the one warm meal a day that they get. I have friends that live down on Highway 60, and sometimes they go to Rockbridge. It's a vital social part of their lives to have contact and to be seen daily. I go to the Richland Center site, and there are several of us that are there regularly. It's very important from a social standpoint, and I want to request the county seriously continue to support the social programs for the county, because it keeps us running together as a community rather than being isolated and left out. And there are so many people that are really quite destitute, and they have no means to do otherwise. And so this is a very important program for the county and our community to support. Thank you.
Thank you. That's all I have on our list right now, but I also have a couple to communicate. I was contacted by another county board supervisor who, yes, I apologize. I was contacted by another county board supervisor who would like me to express to community members' concerns. They want to express they weren't able to come to the meeting today, but wanted to express their support for the food program, and also to mention, and how important it is to them, but also to mention that they would be willing to pay more for meals in order to help keep that going. Another one that I have is a letter here that was asked to be read today. This is from a Marilyn Reinhart. She says, "My name is Marilyn Reinhart. I was a member of this board from 2008 to 2014. I am on the Richland Hospital and Clinics Board of Directors, and I volunteer in the Richland Community Free Clinic. I know that HHS has been cutting positions or leaving positions unfilled to try to trim the budget for many years. I also know that we are underpaying professionals compared to other counties. Yes, unfunded mandates and court-ordered placements are part of the problem, but the many services provided by HHS are often invisible to the greater community. HHS is a large department which looks like it has a much larger budget compared to others. This comparison is not apples to apples because of the many purposes served by HHS. That said, all areas have to work together to build the economy and make the county a good place to live. I see two large categories of needs that must be considered. One is the access to outside sources of support for those who have already served the community, older adults and veterans. These people need advocates to identify their specific needs and to guide them through the maze of the application processes. This would not only help these individuals, but would bring outside money into the county. The other area is that of people who need help to get through some difficulties in their lives, which keep them from having a higher level of community involvement. Major problems exist with computer skills and access and language differences. One such group is people with behavioral health needs that are not available through any other sources, particularly young people whose families have done all they can. The areas of communicable disease, maternal child health, children and youth services, and environmental health are vitally important to maintaining and building a workforce and to attracting investment in the community. Professionals and support staff are needed to know the resources and build networks to explore other sources of help. We need to have a community that builds, not a community that cuts out the very services that support building more opportunities. HHS is possibly the most important area to be working toward economic stability and development. We will not continue to have a quality of life if these services are targeted." Okay, again, I want to thank you all for coming and sharing. I would like to encourage you, if you have the time and are able, to stay and listen to some of our discussions on these issues. Budget levy reductions, the discussion for that and decisions will be earlier on in the agenda here. So if you are able, that will give you a little more information into what we are facing, the decisions that we're making, and the thought processes that have been going into those decisions. So with that said, we're going to move on to agenda item number 7. This is to review and discuss the Health and Human Services staffing levels. As was referenced, this has been brought up in the referendum ad hoc committee, and we've been asked to take a look at that. We are doing that, and this will continue to be an ongoing discussion. So we are going to briefly review what Director Clements has prepared in regards to that.
Thank you.
So I'm looking at the agenda item cover 7 and 7A in your packet. And the two really go together. We have taken a real deep dive into our staffing. We have for staff, what we have for staff, and what is on the books through the county. There are, if you look at the agenda item labeled 7, there are 13 positions that have sat empty for at least a year, if not longer. We are proposing to have these taken off the list of employees that we have at this time. And if we want to fill them in the future, it would have to be cleared through finance and personnel and through the county administrator. We're really trying to be transparent with the community, with the county board, and showing that we don't intend to fill positions that are not needed. In doing this, our numbers then would, for total staff, part-time, full-time, and/or leased, would then be changed to 69. And so we would be asking that the referendum ad hoc committee in their public education would be changing the HHS employee numbers. Many questions have been brought up about our mental health unit or the behavioral health unit. There are 9 different services that are provided in that unit. We provide birth to 3 services, children long-term support services, coordinated service team, comprehensive community services. We have the outpatient, we have a substance abuse counselor, treatment court, adult protective services, and crisis services. So for the 20 employees that are that we are able to hire, those cover 9 different programs. One of the things that they've been doing comparisons in regards to what number of employees we have versus others, it's really important to take a look at what services are provided. Are there any questions?
This is on. Okay. 7B and 7C kind of speak to one of the questions that was brought up in public comments. The 7B is the original presentation that was shown at the referendum ad hoc committee. We're having some technical issues this morning. But then 7C has some updated numbers. And well, I guess while she's got this one, oh, there it is. Okay. So this is 7C. This is the edited version that shows the actual numbers in each of those departments. So it does change the overall numbers from 75 to 69.
Yes.
Okay. And then I didn't know, did you want to discuss the other one with the color coding on it at all? I think that's 7D, just so the committee is understanding what you're doing here.
So 7D, that is a spreadsheet of all the employees. What we have done when we've gone through this is the 2 red positions are positions we're asking to be permanently eliminated from our list of employees. Those are nearly impossible to fill, and we have started to contract out those services. So we would not be looking to have those 2 on the books. Those positions are needed for the birth to 3 and the children's long-term support program. The green items are positions that we are, the green are on hold. So those are the positions that we're asking to be removed at this point in time and only be able to fill with the approval of committees in the future. And then the orange are the same things. Those are the least positions. And the yellow is just not exclusive to Health and Human Services. So Corporation Counsel is listed on there. He does work with our department, but also with many other departments.
Okay, so then if we could bring back up number 7, if it will work. What we're asking then from the committee is a motion to approve the elimination of the occupational therapist and speech and language pathologist county positions, and add the requirement to submit a request to the county administrator and finance and personnel committee prior to filling the 13 long-term vacant county positions listed below, and forward the recommendation on to the finance and personnel committee and county board for approval. So are there any questions from the committee in regards to this? And if not, do we want to move forward with making this a motion? Yes, Mr. Gatchell.
Just a question procedurally, I guess, maybe for Administrator Langrick. So in practical terms, we're leaving these positions on the books, but adding a requirement for board approval at the finance and personnel level, or what exactly is happening?
So from your position of being policy setters, you'd be looking to make these adjustments in the compensation classification and authorization table. The position titles here would be left in place, but with annotated points of not authorized to fill without consent of policymakers.
Okay. So practically speaking then, we come back in 5 years and we need another public health nurse position because a pandemic, which could never happen, right? This isn't necessarily viewed as HHS creating a new position to hire. This would be taking from an existing position at the approval of a finance and personnel committee.
You're going to kind of keep it in your built-in structure, but you're going to be saying temporarily, we're not going to fund these. And if we need to inject and put people into these seats, then it's going to require a decision by policymakers.
Thank you.
Any other questions? Yes, Mr. Van Landwick. Okay. Do I have a second? All right. Any more discussion? I would say this is just to really help make it clear that these were not positions that are intended to be filled or are being budgeted for. So, all right. If there's no more discussion, then all those in favor, please say aye. I did. All those in favor, please say aye. Opposed, say no. Okay, thank you. So that moves us to number 8. Oh, and I should have mentioned at the beginning of the meeting for committee members, if you haven't updated your or synced your iPad recently, there were several documents that were added yesterday, later in the day, and then some items added this morning. So number 8, for example, was added yesterday. There was a 9G that was added yesterday, and then some items for number 12 were added this morning. So you might want to refresh your iPads. Agenda item number 8, review and discuss possible relocation of the Veteran Service Office to Community Services Building.
Could you look at action, the 7A? We would need a vote on that.
Oh, I must not have gotten an updated. Sorry.
That's okay. So that would be requesting that the updated numbers be sent to the referendum ad hoc committee.
Okay, I thought this was just one that referred it to us. I did not see that. Okay, so we need a motion to, can you state that again?
So we would be asking for a motion to send the updated HHS employee numbers to the referendum ad hoc committee.
Okay, thank you. Can I have a motion? All right, Mrs. Ruderstorff, second by Mr. Severson. Any discussion? All those in favor, please say aye. Aye. Opposed, say no. Okay. All right, so number 8, as I said, review and discuss possible relocation of the Veteran Service Office to Community Services Building. This was asked by the committee to have a little bit more background information in this discussion. If this were to happen, what were the logistics? How would privacy issues be dealt with? How would the Health and Human Services staff be assisting the Veteran Service Office? So Director Clements has prepared some background information for us. That is item number 8 in your packet.
So I just wanted to clarify some concerns that have been raised about Veteran Services moving to the Community Services Building, and want to attempt to answer those questions that are out there. Number 1, we do work with veterans on a very regular basis. The ADRC, which is does the most tracking out of all the different units over the last 2 years, so 21 and 22, served 295 veterans, and that is what we are aware of. So that's through our elder benefit specialist, our disability benefit specialist, our INA specialist, and through the transportation program. I'm sure there's also veterans who are receiving meals, so we do work and serve veterans on a very regular basis. They're also being served through our behavioral health unit. I believe in the last month, a little bit more, we did have to reach out to CVSO NOC and had her assist us with someone who was having some issues with funding for his placement. And so it was very helpful to work with her in regards to that. We also are currently working with a veteran's wife to ensure that everything is taken care of when she signs up for Medicare, and making sure that the VA is aware of everything and that she is getting the services that she needs. So it's very common that we work with veterans on a very regular basis through all our units. We are also have hired a CCS supervisor, and she has a long history of working with the VA, has done individual therapy for those veterans who suffer from PTSD, and she does want to provide that service through the county. And so that will be an additional service that will be provided to the veterans in our community. The next question that came up was really that staffing assistance. How would we do it? As Marty talked about, we are going to be doing more work with less staff. That is just part of all of this that we're going to be doing over the next few years. So we will really be relooking at the different job duties that people have and adding these services on to their duties. The final thing is the privacy. Every single employee at HHS is HIPAA compliance trained. Every year they do a HIPAA training. We would not have access to the Veteran Services records, files, that would all be separate from HHS's records. So that would be access that Karen would have to her own area, and we would not have access to that. If there were paperwork that was dropped off and the veteran did not want HHS staff to see that and she wasn't available to take the paperwork, we could do things like putting a locked box in the lobby area that only Karen has access to that, and so they could put that information in the locked box. We are very open to doing what we can to make it work, to ensuring their privacy and to supporting the services and the veterans in the community. Are there any questions?
Okay, not hearing any questions. Thank you, Director Clements, for that background information. So that will take us to item number 9, which is approved 2024 to 2027 budget levy reductions per resolution 2022-96 directive. So a couple of things before we get into that. I just want to remind us what we were tasked with. We've been tasked to develop a recommended list of proposed project levy reductions of $320,000 in 2024, $637,000 in 2025, $783,000 in 2026, and $1,004,000 in 2027. I would like us to look at item 9G prior to getting into the specifics. This was something, and I don't know if you can zoom in on that a little bit. So Melissa Luck, who chairs the Public Safety Committee, had prepared a spreadsheet like this for her committee because it has multiple departments. And so I asked Stephanie to do this for ours to kind of give us some background, and I really appreciate she put that together for us. For our department here, it's not as complicated because there's only 2 departments listed. For public safety, there were quite a few more. But if you look on the far left, it lists our 2 departments, HHS and Veterans, the 2022 levy budget for each department, and what percent that would be of total if we totaled the 2 together. Based on that number, the percent of the total, you can then see as you go across what that would look like to contribute towards those levy reductions, again, based on percent of the overall levy budget. So that gives us for Health and Human Services a total by 2027 of $971,291.19, and for the Veterans Office, $32,708.81. Now, I am not saying that we have to stick to those numbers strictly, but I wanted it to give us some background on what this looks like if we are dispersing the budget levy reductions in a fair manner. So with that in mind, does anybody have questions on that document? Okay, so then that will take us to 9A, which is the Veterans Service Office Levy Reduction List and Referendum Recommendations. There are a lot of documents listed for both 9A and 9B. Many of these are similar or the same as what we had last month, which we discussed in great detail at, or not last month, but at our last meeting. I guess that was last month. At our last meeting, we discussed in pretty great detail all of this background information for the proposed budget levy reductions. We can certainly discuss things again, but what we are tasked with today is making some decisions that we can forward on to finance and personnel, as well as the things that we would like to see placed on referendum be forwarded on to the referendum ad hoc committee. So for 9A, which is the Veterans Service Office, it looks like we have, okay, so the ones that pertain to that would be 9C, 9D, 9E, 9F, and I think that's it. So let me look here. I think the one that we need to look at in particular, so first, so 9C was information from last month, and 9D is a request prepared by CVSO NOC. If we have that brought up, she can read that to us.
Good morning. So this is just a blanket statement of what we had discussed last month, my request, and I just brought that forward to this month to be viewed again by the committee. Would you like me to read it out loud?
Sure.
Okay.
Thank you.
We're asking the committee to consider that the Veterans Benefit Specialist be placed on the referendum and also be funded through 2027 so that the veterans population can be monitored. We would like the committee to consider leaving our office location in the courthouse.
And then 9E is the resolution response. This is the spreadsheet that Administrator Langrek had sent to department heads to prepare in regards to the budget levy reduction. So it lists all of the
Proposed cuts.
proposed reductions in those
Correct.
first couple of columns. And then if you go over to the first green, last blue there, it has whether that request is considered to be added to the referendum. So this was prepared by CVSO NOC. We went over this at the last meeting. So this is what she used then to prepare 9F, which is our agenda item cover. And this is what we would be looking at to determine what motion we're going to make. So if you pull up 9F, it's a motion to approve listed options for cost savings to meet budgeting requests for the Veterans Service Office, if that would be due to an unsuccessful referendum. The starred items in the list below are the ones that would be forwarded to the referendum ad hoc committee for their consideration. The following would be the potential levy reductions: discontinue issuing cemetery flag holders to family members of deceased veterans, elimination of Veterans Benefits Specialist office staff, decrease commission per diem, decrease commission mileage, cancel the ETK computer program. All right, so I'm going to open this up for some discussion on this and questions, comments from the committee.
Just to clarify this is going to be presented to the ad hoc committee for the referendum, and if they decide not to have a referendum or it doesn't pass, then these are the measures that you plan to take after that?
These are the proposed cuts for the budget. The two that will go to the ad hoc committee, and then anything this committee wishes to see after that as well, as far as the non-asterisk, whether you would like to see that or not. I think I said that right. Does that sound?
Yes.
Okay.
So if this referendum with all this on here passed, you would still have the veteran benefit specialist, and you'd still retain your office in the courthouse if the referendum passed.
I think that's a separate issue. One of the potential moves would be to keep my office staff and both of us relocate to the Health and Human Services building. I think there's a lot of different kind of components that play into that. This is just for the budgeting and the funds available to keep that position, as well as the cemetery flag holders. Is that correct, Madam Chair?
Yeah, I believe that's stated. It's not stated specifically whether that would involve the move or not. It's simply whether that the half position that we have is budgeted for. Does that answer your question? I do think we would also need to address, because if you look at 9E, we can see her recommendations for when these reductions would take place. I think the first 4 would be starting in 2024. However, as CVS ONAC has mentioned, she was requesting that the benefit specialist position item would be moved to 2027. So that would need to be addressed, I think, specifically in that motion. Not. One moment.
If you look at the item here, this is item number 9E in your document. It's built in with the benefit specialist, and correct me if I'm wrong, CVS ONAC, but it's built with the benefit specialist as a reduction for 2024, listing it out there. The request, though, is to have it for 2027. So
Okay.
if you're trying to meet your numbers underneath 9G of the appropriated, I'll give it a second there. If you're trying to meet those marks of your appropriations that you're requesting from the Veterans Office, then you would have to consider if there's not a benefit specialist position reduced in 2024, then you would be under the requested 10,000, the additional 10, the additional 4, the additional 7 for until you reach 2027. Does that make sense?
It does, however, and Stephanie, correct me if I'm wrong, these were just the numbers, the way it played out on here, but I think when we had the document from Health and Human Services, the cuts that you guys had proposed making in 2024 actually put us over the ask of that particular year, correct? So there is some like leeway with those.
So sorry about that. When we set up our spreadsheet and our cuts, it was not taking into consideration anything from the Veterans Office.
Right, okay.
I think we're looking at 9B, though, to make it more confusing to you folks doing it at home. We'll give it a second just to pull it up here. So I think what we're saying, though, is if we go to the very bottom of 9B, you had your amount HHS of, say, $320,000 in 2024. That the proposals there is you have $39,000 of actual reductions over that in the event that you exercise everything that's proposed there. Am I saying that correctly? Okay.
Yeah.
Yes.
And we're all tracking?
I think so.
Madam Chair,
Yes, Mr. Seep.
we discussed, Madam Chair, at the last meeting.
You might need to speak into your mic, Mr. Seep.
Oh, sure. I thought you could hear me well. We discussed at our last meeting the ETK entity in the Veteran Service Office, and Karen indicated that that is a pretty essential tool for her office work. I think there was an initial investment of something like $2,000. I'm not sure, but there's an annual renewal fee, isn't there? Licensing fee. I would hate to see us give that up. Every county in the state has that tool. Karen had asked for it on numerous occasions, and we've had it 1 year, and now we want to throw the baby out with the bathwater. I would like to see us keep that. And then I had one other question about the flag holders or the grave, the flag holders or the grave markers.
I didn't see any expenditure for those in the previous year, and I note that there's a $1,500 reduction proposed for that. Is that correct, or is I misreading something? Because if we didn't spend any money, what are we reducing?
Okay, we'll let CVSO NAC respond.
So occasionally, if I run out of funds for the flag holders or the markers, then I'll take it out of the budget item for the flags. The flags are very seasonal. Sometimes cemeteries will use their flags for 1 to 2 years. Sometimes they only use them for a week and dispose of them and then come in to get more the next year. So the numbers between those two budget line items fluctuate for me.
So you pay for the flag holders out of the flag budget. Is that it?
Not fully, just occasionally, if need be.
Because there was $1,500 in the line and nothing was spent. So that's puzzling to me. I don't understand why it's there if we're not spending any money on it. Why would we go to another account line to fund it? But so anyway, what I'm saying is I am totally in favor of continuing to provide those flag holders for our veterans and their families. And so I would be in favor of not reducing the budget for that item unless Karen sees another way around it, which I don't see. I think it's important.
So just to clarify on that, I believe Mr. Seep is saying he would like to see the items of the cemetery flag holders and the ETK not be reduced. Can I ask again for the ETK, what is the ongoing cost for that
$918 a year.
per year? Okay. All right, other committee members.
Excuse me. The flag holders, do we have, why would we have $950 spent for flag holders?
No, that was for ETK.
Pardon?
The $918 was for ETK. I was asking her how much it is
Oh,
per
yes.
year.
Oh, I'm sorry.
It originally,
Jumping from one to the other here.
sorry, the ETK was originally $900. That's what we contracted it for. And just in 1 year, those fees have raised $18. And I raised concerns with the company and they said that they're probably due to go up again. So that was one of the reasons that I put that on there, because that is something that should be taken into consideration.
But it saves a lot of work for you, doesn't it?
Correct.
Helps make your office more efficient. Correct?
Correct.
So I'm in favor of those two items not being reduced from the budget.
I would need to do some math to see how much that would accumulate over the next. And while we're doing that, can I have any other committee? I mean, we need to make some decisions here. So now is the time to be talking or
Can I just
stating your opinions? Yes.
So just again, just to reiterate about, for those that maybe weren't here for the last meeting, is that these cemetery grave markers are the 6-inch round holders that put the flag in at the cemeteries. The first one, when the veteran passes away, we issue the first one to the next of kin. Any ones that have to be replaced after that because of lawnmower damage, perhaps, then the families would pay to order those themselves. So the first one is issued, but the replacements are not. There are other counties around us that have stopped funding these. So that's why I felt that it needed to be added on there as a possibility, because like I said, other counties have stopped funding these. So it's not a mandated service. It is optional. people love them, and it would probably break people's hearts. But like I said, you said yourself, Madam Chair, these are hard choices. So I just wanted to put that option out there as available as well. Thank
Okay.
you.
Yeah,
Thank
just-
you. So just for background for the committee, based on my numbers, which my math could be off, but I think for the cemetery flag holders, it would be over the next 4 years, if we put that back in, 6,200. For the ETK, it would be 3,672 for approximate value of both of those together of 9,872 for the next 4 years, if those were added back in. Mr. Van Landwit.
Thank you. If we were to go along with Don's suggestion, would that keep us still below the level that Karen was asked to reduce her funding?
It would not, because currently with the total I mean, when you say Karen was asked, I put up that night this as informational only. We did not
Right.
specifically direct her to come up with 32,708. Currently, what we have proposed is, I believe, less than that, even with everything included. However, the HHS cuts that had been proposed were not including this number, correct? Okay.
So I was just wondering, everybody has to cut. If we
Yes.
were within balance with that addition, which I agree with Don is necessary, I think that's something that veterans look forward to when they go through cemeteries. And I myself, many times look for those when I do that. So anyways, that's my comment. I would agree with what Don said.
I don't know if we have a full total with all the reductions listed for that. I'm trying to do it really quick here.
Well, this is only a recommendation that we're making to the ad hoc committee anyway.
And finance and personnel.
Yes. Subject to change.
And Madam Chair, and I just wanted to reiterate that was one of the asterisks listed on the nine, what are the nines?
9F.
Yeah, 9F,
Yes.
thank you. That's the reason, one of the reasons why I listed that on there is because I did want that to be considered for the ad hoc
Okay.
referendum as well.
So my quick chicken scratch numbers here, if we included all of these possible reductions, I think the total is around $28,488. Yes, Mr. Gatchell.
Kieran, what's the rationale for including the benefit specialist position in 2027? Or extending it out? In a clarifying comment, I guess, you're not insinuating we're going to have another referendum in 2027.
No.
You're saying for this current referendum, the question would be, in 2027, would we continue to fund the benefit specialist position?
It would be expected that it would stop funding in 2027. At that time, we would be able to look at the population. I think the estimates are maybe not correct from the trends that I'm seeing. And so it could possibly be reconsidered at that time, but from now until then, it would be planned that in 2027 that the position would be eliminated. If I feel that I could explain it to you and not justify it. But if I felt that I could justify it, then I would ask for reconsideration, but it would be planned to be eliminated.
Madam Chair.
Mr. Steve?
Yes. Could I ask Mr. Langrick, just for a little background here? The original recommendation was for as I understand it, and please correct me if I'm wrong, was for the discontinuation of the position at the end of this fiscal year. And then subsequently, there was discussion to continue it for 2023. For the 2023 budget, Karen's additional request is for it to continue through 2027. I would not agree with that request because I believe the budget changes from year to year, needs to change from year to year, and I think that's a question that could be evaluated at the end of each fiscal year or each calendar year. I don't think we should be tied in. I don't think the administrator should be tied in. But the original recommendations, I believe, from the administrator were to discontinue the position at the end of this fiscal year. And Mr. Langbrett, could you correct me if I'm wrong or elucidate?
In July of this last year, when we rolled out a project with our financial forecasting, one of the elements that was recommended by myself was a reduction of that position going forward into 2023. Put in as a mitigating factor, knowing that that's a reduction of 1/3 of the entire output or production from the office. If support was needed to then look at moving the position then over to HHS to be able to allow for some type of support, knowing that you're not going to be able to recoup the full 2/3. That proposal was amended by Finance and Personnel to reincorporate the benefit specialist back into the 2023 budget, which it has been added. And then also then through Finance and Personnel came the adjustments then to the resolutions that pushed down then the financial responses that they're looking back at what we're talking about today. Does that help elucidate?
Yes, and I would tend to agree with the original recommendation of the administrator. He's been working on this for a long time. He's responsible for evaluating the overall needs of the county and of this particular department, and he's been analyzing it for several months in a more intensive way.
Mr. Seep, can I ask to clarify something on what you had said? Because I hear you're saying that you wouldn't agree with the recommendation to move it to 2027, but I believe you said a few minutes ago that it was something that could be looked at each year. Are you suggesting that we don't include this in our projected cuts and that it's just something that year by year we look at as a budget? I'm trying to understand what you're saying.
No, I'm suggesting that if the committee were to recommend that it be continued through 2027, I would be opposed to that. And
So do you have a specific recommendation?
well, my recommendation really is to abide by the original recommendation of the administrator to eliminate the position.
Well, we're not making any decisions on 2023's budget. We're looking at 2024 and beyond.
I don't know how to respond to that.
Well, that is what we are tasked with, Mr. Seep. Making some budget levy reductions for 2024 through 2027.
All right, I'm opposed to extending it beyond 24, or 23 rather.
Okay, so your recommendation would be to eliminate it starting in 2024.
Correct.
Okay. Other committee members have comments? Now, again, I want to clarify that what we have before us as a motion does not address the potential move or not move. So that would need to be addressed separately if it gets addressed. This is simply looking at the proposed reductions that are listed on 9F. So we had a couple of committee members make suggestions, or I think Mr. Seep had several suggestions for possible amendments to this motion. I don't know if you want to make those as a motion, if we want to approve this as is, but we need to decide how we're going to move forward here. Mr. Severson.
Madam Chair, I got a question with the elimination of the Veterans Benefit Specialist. If that position was eliminated in the Veterans Service Office, would there be an employee over at Health and Human Services that could be accredited to help assist with the Veterans Benefit stuff, like a clerical assistant that would have a dual role?
I'll let Director Clement answer.
Any veteran can be accredited. In fact,
I think Mr. Severson's question is there someone who would be able to add that to their list of?
I think Mr. Langston would be best to address that.
Well, correct me if I'm wrong here, but we would be in a situation where in order to maintain accreditation, a person has to work in handling claims so many hours of its 1,000 hours annually. So you would kind of be right back into the same situation of having a part-time employee dedicated to being a benefits specialist in order to do that.
That answer your question, Mr. Severson? I would like to point out that on the 9E document, when it has elimination of benefits specialists, the workaround is listed as using 2 part-time employees from HHS. So even though we're not specifically making a motion on those, that's kind of included as part of the workaround if we were to move forward with that. But that could be something addressed at that time as well.
Madam Chair, just one other thing is that in order to be accredited, they either have to be a VSO assistant, a benefits specialist. They have to have that title, as well as the 20.5 hours minimum. It has to be 1,000 hours a year, as he said. So the title also is included and counted in when they're accredited or not. Thank you.
All right, so are we ready to make some sort of motions or recommendations here, remembering that this is going to go on to Finance and Personnel Referendum Committee and eventually to County Board? And I do know that Mr. Sean Murphy Lopez has also mentioned that after referendum takes a look at this, there will likely be things sent back to us for us to continue working on as a committee. That's not on the agenda at this time. We have heard public comment. Mr. Langred?
It's my first time with the microphone, apparently. Do we have a motion that's on the table?
We do not have a motion on.
So I guess I would recommend, Madam Chair, if you would entertain, I think in order to try to approach it is maybe the first element of addressing the benefit specialist position, if you want to entertain by motion, keeping it as a 2024 reduction versus taking it off the plate until 2027. From there, addressing the other concerns on there, looking specifically at 9E, if there are things that you would want to remove from consideration or how you would want to change that matrix for consideration by your ad hoc committee. Sealing those items up, then if you wanted to make further independent action on location of services and potential movements, to do that then as a third one would be my recommendation.
Madam Chair, I'd make a motion, if you permit, on the first element of Mr. Langbrick's remarks. That would be to, I move that we recommend that the Veterans Benefits Specialist position expire at the end of 2023. That consistent with your statement, Mr. Langbrick?
I think so. On the matrix, though, it would be expiring in 2023 unless funded through an approved levy item is what we're indicating on there.
Okay, I will need a second in order to have discussion on this. Is there anyone that wishes to second? Mr. Van Landuit? Okay, discussion. Mr. Severson?
Madam Chair, Ms. Knock, are you accredited also? Can you do the same stuff as the Veterans Benefit Specialist?
Yes.
And are there times where the Veterans Benefit Specialist and you are working on 2 separate cases and have to be out of the office and traveling to deal with that certain issues?
I'm sorry, say that one more time.
Like would the Veterans Benefit Specialist be out of the office working with another veteran, let's say if it made it to the federal level, and would you be doing the same thing if you had to go to Madison? Does that happen all the time in your office?
Not all the time. I try to do home visits during the day. Sometimes I have to do them later at night, but for that time, the benefit specialist would be in the office working with the veteran while I was out of the office, things like that, you mean? And then there's times when one of us has to go to Madison, or in the upcoming years when one will be at conference and the other one won't. Then the benefit specialist would be there to assist.
Clerical assistant, could they assist too?
They wouldn't be able to they wouldn't be accredited to file claims.
That's what I was asking about, was accredited. Like if you're working on one client somewhere else, there would be a delay in getting the claims processed.
Right,
That person was there because your clerical assistant couldn't process those claims.
correct.
Mr. Bear?
Question, Madam Chair,
Yes.
for Karen again. I think you said before that the veteran specialist wasn't just an expense, but it also brought in services and revenues. Could you refresh my memory on what that number would be like?
I actually brought that forward from last month. It's on the GDX. It talks about that $12.1 million that federal aid comes straight to Richland County that goes into the veterans' pockets. So every claim we put in, that brings that cash flow and the health benefits to the veterans. And then the last count was the Department of Revenue for the state of Wisconsin. We helped bring in $144,000 by people paying their property taxes and then being able to be refunded that money, which helps them. I know for a fact that we've had veterans that were very close to being foreclosed on their house and property. And with this benefit, they were able to completely pay off the debt that they owed to the county. So those are the funds that, by having somebody able to fill these claims besides me, then, and plus the outreach, the parades, there's numerous ways that we help with that. And again, the veteran population is in question, and that needs to be considered. And that's why I pushed it out to 2027 so that we could watch that. But I can tell you right now, in the month of October, so far, we've got 4 new veterans that have moved to the area, and I've already referred them to different places around. And that, again, is one of the reasons why I question the estimated population by the year 2027, and the reason that I wanted to not make it in 2024, but to push it to 2027.
Madam Chair,
Just a
if I
minute.
just add one point.
Hold on, Mr. Steep. Does that answer your question, Dr. Barris?
Yeah, I mean, just to be clear on it, that means that if the veteran specialist was eliminated, part of that number would be significantly reduced if you had to do that job by yourself and with some clerical help.
Every year, that money, in 2014, it was 8 million is how much was brought into the county, and that was before I got here. And so since 2015 to 2022, we've increased that by 4 million, and that's because of the benefits that we offer. If you were to eliminate the benefit specialist, then that number would rise, but at a much slower pace.
Madam Chair.
Are you done?
2 points.
Mr. Steep?
Madam Chair. With your
Yes,
permission.
Mr. Steep.
One is, I think it's very important to keep in mind that if the benefit specialist is going to be here throughout 2023, there's plenty of time to work out questions about moving and evaluating the workload, and so as well as looking at the population. So that you're not going to have, you can decide at the end of 2023 if there's a pressing need to continue with the part-time veterans benefits specialist. Fine. You may draw the other conclusion because you may involve human services as a support service here. So I think it's important to give it a year to trial this. And secondly, those numbers are cumulative over the years. It isn't that $8 million was brought in 1 year. They go back years and years, the accumulation of those veterans benefits. So sometimes you have to be careful to interpret those numbers.
I do want to say we need to be careful if we're recommending something for referendum and then we get to 2024 and we decide, well, and let's say the referendum passed and then we decided, well, actually, we or it didn't pass. I think we just need to be careful that we're being completely honest with the public about what it is that we're asking, so that if we come back to it later, and it's not like we can say, well, never mind.
Well, it's such a
We asked you
small
that,
issue.
but never mind.
It's such a monetarily, it's an issue that I wonder why I would even want to go on the referendum. You know?
Well, we haven't discussed that portion of it yet. I'm just saying we need to keep that in mind as we're making decisions. Okay, other discussion on this. Administrator Lang.
So, Madam Chair, your current motion, to the best of my memory, is to have it on there for reduction in 2024 unless it is funded through the referendum. So the
So it
motion on
is-
the table right now would suggest that it's going to be that situation. It's going to be
Okay,
put on.
so it would be put on referendum. Okay, so we have two parts kind of to that motion. Any other discussion before we go to vote? Okay, then I guess we will take a vote on that. All those in favor of, could we read it one more time, please? Have it? I'm sorry.
The motion was that the benefit specialist position would expire at the end of 2023, pending approval of the referendum.
Okay. Mr. Gotchell, did you want to say something?
I would like to propose an amendment to fund it through the end of 2024. Put it, so essentially we're taking the yes and we're moving it over 2 columns. But
Okay.
my amendment, the amendment I'm proposing would be to fund it 1 more year.
Okay, I would need a second on that amendment. Mrs. Rudersdorf seconds. Discussion on the amendment?
Yes. My discussion is this further undermines the authority of the administrator based upon his original recommendations. And we hired an administrator to manage personnel, to manage our budget, to manage systems, and to manage staffing. And it's inappropriate, I believe, for me as county board member to take an action which undermines his authority. So I'm opposed to greatest respect that.
Thank you, Mr. Seat. Mr. Van Landewit?
I'd like to ask that Mr. Langrick respond to that suggestion that we go 2 years instead of the 1.
Okay, I'm going to allow Mr. Gotchell to speak, and then we'll let Mr. Langrick, if he would like to respond, he may.
I would just like to respond to that my intent is not to undermine at all. I'm actually thankful for the recommendation and the proposed path forward. I just don't think 1 year is enough time to evaluate this. 2 years gives us a better sample size, in my opinion.
I would say it's still being put towards a referendum, so the decision point will come from the people on whether or not there's an evaluation on 2024. Comments from Chair Glassbrenner kind of do need to kind of ring an echo, though. If it is something that is going to be offered up, then it would be appropriate then when that time comes on a yes or a no, then the fate of that item is decided. From a monetary perspective, you kind of encumber, if you will, $22,000 of extra burden, though, that has to fit in meeting your resolution to go to finance and personnel. I think I cover everything, Karen and Tricia.
And just to clarify, Mr. Gotchell, yours was still including that it would be placed on referendum. Okay. All right, any other discussion? Not all those in favor of the amendment, please say aye. Aye. Opposed? Okay, the amendment passes. So now we need to vote on the amended resolution, correct? Or recommendation?
Yes, now you'd be voting on
Okay.
the
So all of those in, well, do we have any other further discussion? Okay, what is the motion? Yes, let's state that again.
The motion would be that the benefit specialist position would expire at the end of 2024, pending the approval of the referendum.
Good? Okay. All right, so now we need to vote on that. All those in favor of the amended motion, please say aye.
Aye.
Aye. Opposed, please say no. Okay, one no, so the amended motion carries. Okay, we have other items to address, though. If we're looking at 9E, the 4 possible reductions on the top, we would need a motion on how we want to address those, unless someone has some discussion points on that. Again, this includes the cemetery flag holders, the commission per diem, mission mileage reduction, and the computer program BTK.
In the E-Take program.
So,
Don, can you please speak into the mic?
I just want to make that a clarification on that. Would we be making a motion to, per his point, would that be a motion to remove those from that recommended list of reductions? I think is how that should be probably stated.
Well, you could put it that way.
Okay, so I would need a second for us to have some discussion on this. Mr. Van Landuit, okay, discussion? Go ahead, Mr. Gotchall.
I would like to make an amendment, just because that's the way things are going today, that we remove all 4 of these items for consideration. Taking into consideration, Mr. Seep's recommendation would be to leave on $950 of mileage and per diem. And I think I remember Karen saying that she drives and she takes meals, but she doesn't get paid for, she doesn't claim them for reimbursement. Is that a fair?
I'm sorry, she's referring to the commissions per diem.
The commissions per diem, Don is correct.
Commissions per diem?
Because the committees have combined, and so there's no longer a need for me to have that much funds in there.
Okay.
If there's an emergency where we have to call together the commission because of a veteran's request, that would be the only time that they would need that mileage. And you were correct about you were correct about my mileage, though.
Can I clarify too? You had said that you did leave some in that
Correct.
packet.
Yes.
Okay, so to cover that possible.
Got it.
I'm
So
losing words.
if these are, so to your point, if the committees are combined, now this would just be for an emergency session.
Correct.
Okay.
And she had left funding in to cover that.
Madam Chair, wouldn't
Not included in this.
wouldn't the per diem expenses and the mileage expenses be split between, somehow allocated between the two, between Health and Human Services and?
I don't believe so. Am I correct?
My understanding, and please speak to this, Administrator Langred, is that the committee, the veterans specific committee, since it is no longer and is combined with Health and Human Services, so the funds that I kept in there was for the state mandated commission if it ever needed to be called. So that's
Okay.
That's why I budgeted for that. If the committee would like to see another budget line item in there, I would be more than happy to put that in.
So what I'm so what I'm hearing is we're covered for said emergency that would exist to call the committee together.
Correct.
So this is largely procedural then, that we're removing this 900.
Correct, because thanks to Tricia bringing it up, it was one of those line items that just never jumped out at me. Now that we've combined committees, it just never occurred to me to take that out. So she pointed it out, and so that's why it was late coming to the party and the dance, as you will, because I just as soon as I was aware of it, I wanted to correct it.
Madam Chair, I'd like to strike my amendment.
Okay.
So that the per diems and the mileage payments to this meeting would be charged to HSS, is that right?
That'd be the
Is
word.
that fair?
Yeah.
Okay. All right, so that takes us back to the original motion, which was to remove the cemetery flag holders and the ETK program from the list of reductions, which I will just remind you guys, if we remove those for the next 5 years, that is a total of $9,872 that would be added back into our budget levy.
Does that mean that you have to find that money from somewhere else to meet the reductions that were requested?
That would mean you'd have less options to add more things in when you start your discussion on HHS, yes.
And it is just a reminder that I did put an asterisk next to that. And I think that that's one of those, I think this is one of the things that the people should vote on whether they want that service offered or not, at the expense of the county. So that's why I put the asterisk next to it, because it would be nice to hear what the voters think if we should carry that or not.
You did not, however, on the computer program, I don't believe. I think you had
Correct.
just on the cemetery
Correct.
flag holders.
Yep.
Okay. I'm saying she recommended that the cemetery flag holders be placed on referendum, not the computer program. Mr. Gottschall.
So when we vote on this, are we taking the recommendation for the additions to the referendum as well with it? Or
I don't know if that was stated well, no, because the other two, the commission mileage reduction and the per diem, neither of those were recommended by Ms. Knock to be on referendum. So if we voted yes in favor of this motion, it would. Are we just removing those, or are we also making a motion to put the other two on? I guess that's the question before us.
The motion was to remove the software and to remove the flag stands from consideration. Essentially, you're going to fund those and find out how to solve your response to your resolutions through some other types of means.
And we have not voted on the others.
The ones that remain on is the mileage and the per diem, and those are recommended as reductions, period, not to go on to the resolution for consideration. Did I state that right?
so essentially, if this motion passes, we're not forwarding anything else to referendum for consideration except the benefit specialist in the year 2025.
Correct. Are we ready to vote on this, or do we have more discussion? Mr. Van Landwit?
If we were to vote on this now, and we've got much more to discuss, if we're going to be kicking ourselves in the rear by doing this and not accepting other things that we may have to consider cutting or keeping a little later on.
You mean in HHS?
Yeah, I'm wondering, how to prioritize this, even though I believe it's important. We are faced with a lot of reductions that are required. And so I'm really in a quandary as to how to deal with this at this time.
Would that be a motion to postpone then until later in the meeting?
Good. You could do that, or you could vote on it and simply come back to rescind your previous motions and adjust it as you see fit.
If I may, I think that would be a good idea if we could postpone this, just table it until we've gone through the entire program, and then come back to it to see how that fits into our overall suggestion as to what we do.
Okay, so a motion to postpone until after the discussion of the HHS budget levy reductions. Procedural comment, do we need to vote on that? I don't think we have discussion or vote.
I don't think you can have discussion. I think it just becomes a vote.
Okay. Okay, so we'll need a second then. Second by Mr. Gottschall. All those in favor, please say aye. Aye. Opposed? Okay, so motion postponed. That takes us then to 9B, HHS levy reduction list and referendum recommendations. I believe we're going to be looking at the one that's actually labeled 9B. There's a levy reduction summary sheet and a resolution response spreadsheet. Director Clements.
So if you look at the 9B in the agenda item cover, it lists on there the proposed levy reduction items. The ones that are starred are the ones that we're requesting to be sent to referendum. The majority of these are the same as what we talked about at the last meeting. The one difference is we have, so with our nutrition program, the last couple of years, we have received ARPA funds, and that has decreased the amount of levy that we have needed in that program. Those ARPA funds will be eliminated at the end of 2024. And so we are going to be asking that in 2025 that we have an additional 20,000 in levy to be added to that program so that we can at least maintain our current level of funding in the nutrition program. It doesn't increase it, but it maintains that level. And that would be, go to the yellow, the third page. So there's two parts to that. One is we're removing the nutrition program from public health and having it into the ADRC. Part of the unit manager's salary within public health is being covered by the nutrition program. So that would be additional funds that would be allowed to support the program. And then as you can see in the 2025 line, we're asking that it be increased by 20,000. To do that, then we decrease the amount of savings in the absolute last line marked agency-wide. So with that, that's another addition. We would be looking by the end of 2027 to eliminate 5 positions, whether it be part-time, full-time, from our list of employees. And we adjusted the savings there to make sure we have the needed funds in the nutrition program.
Thank you for clarifying that.
When we put this together, we did not take into consideration veteran services. And that is one of the things that we've talked about is, you know, we're not exactly sure how that looks. So if through all of this, the 22,000 in veteran services is added in the 2025 year, I guess we would be asked to make some adjustments to that so that we don't have as much of a decrease in potential services being provided. The other piece of all of this is, and it's maybe a question for the referendum, or I don't know how this would look long term, if we have increased revenues over the next couple of years, we're not exactly sure how that would look, if we would then could eliminate eliminating a position. I don't know how that works, but those were kind of questions that we came up with and that we're hoping to have some flexibility in the future as long as budget allows, and we wouldn't be adding a position. We just wouldn't be eliminating.
It becomes a challenge when we're doing a referendum for an operations across the 20 different departments with all their different functions. Obviously, that doesn't arrive at your actual question on the ballot. It's going to be, you know, we want to raise the levy for operational expenses to maintain to whatever the language arrives at in kind of a very broad stroke. It's up to then the county board and us to then educate on these are the promises that we intend to try to make with the services on it, knowing that while we're exceeding, if it were to go through while we're exceeding levy for that limit, that you're still going to have operational changes that may move and kind of deviate. Really, the check and balance then comes to if you're making a bunch of promises and you're not fulfilling that with your levy dollars, then it's going to come to the electorate to change the folks that are in charge to make sure that those are being upheld.
So to clarify, if we can account for that $22,000 within something that's not on referendum, there's some room to.
You're not going to be glued directly into a footprint of we have to have this many people and these many types of functions legally. I mean, how we project it and how you're educating folks of what a yes vote and what a no vote means ties into obviously how people are going to respond and vote to it if it's, you know, things that are going to be funded that are of value to them versus are not value of them. The other aspect of it is we do have to make sure that we're accounting for it, because there is state statutes that say if you're not fully expending those funds that you're going above and beyond for levying, that there would be a reduction in the following year's profit share or revenue share coming back from the state. So we would have to understand on how to make sure that it's being expended and that we're showing allocation of those monies above and beyond are being expended so that we don't have a reduction in revenue shares. But you're still going to have some maneuverability on changing your footprints and responding to the way the world is changing.
So this is a on-the-fly question for you, but with what we've already passed as motions, was there anything that, that jumped out at you as changes that you would want to make on what you had worked out?
I guess just off the top of my head, I would look at not eliminating either the CST coordinator or the treatment court coordinator. So each of those, the coordinated service team coordinator has 12,000 in levy, and the treatment court coordinator can have up to 27,000 in levy. And so with the numbers that she provided, I guess that would be my thought, is that we would not remove and not have one of those onto the referendum or the ask to eliminate.
Madam Chair, may we take a 5-second intermission for everybody to look out the window and see that it's snowing? One of the Chicago newscasters was the vice president in charge of looking out the window. And I thought this was very appropriate. So welcome to winter.
It's be sunny today. Okay. So I just want, for my own knowledge, aren't we locked in with the treatment court for a few more years?
Yes, so we did not add that to be eliminated until I believe 2026. Yes, so 2026 would be the first year that we would be requesting referendum funds to fund that position. So we would be keeping it in 24 and 25 to honor our commitment with the state.
And how much do they match for that?
We have to cover 20%. So I think we'll, right?
Yeah.
Yes.
Correct. So it's 12, the CST grant is 60,000, so we have to contribute 12,000. And then for treatment court, it's 25%, but it's of expenses, right? So if we, it'll be that percentage on the number on the expenses. So it's not like a flat, we have to match.
Wait, I'm sorry, you said CST. Is that something separate or
No, that's coordinated
that-
services.
Right, so you don't know what we get for the treatment court?
Is 20, that's 25%.
That's 25%. So I
Yeah.
believe that our grant for this year is 160,000 that we will,
Or
I'm sorry, 130,000.
30,000.
130,000.
And we contribute 25% of that. Okay.
And not all of it is true tax levy, some of it is in kind. So,
Okay.
so that's why we say up to, because
Okay. Yes, Mr. C. I don't believe so. We are still at quorum. Thank you, Mr. C. Have a safe trip. Okay, so maybe if we're going to look at those potential options, could you just give us a little bit of background again on what those two things offer? I know we had talked, this was before you came on our, to our department, but we had taken this before the committee, I think it was last year, the treatment court part, and had quite a few people speak in support of that, including the judge and the law enforcement. We've had a lot of people utilizing that particular program. So I had heard some background on that. I'm not as familiar with what CST, the impact there is.
Okay. So the coordinated service team is a position that the purpose of the position is to provide wraparound services to youth who are involved in 2 or more different services. It's somewhat similar to CCS, but typically CST will support families without a mental health diagnosis or support individuals without Medicaid. And so it is a service that we don't bill to any insurance, we don't bill to Medicaid, and it is a service that's provided for families in the community. And it's wraparound services. So it's getting everybody who works with that child together at the same table, really looking at what are their formal supports, what are their informal supports, and making sure that they have the services that they need. Ultimately, the goal with that is to keep children in the community, in their homes, and not have to be in a placement.
And so that was also recommended for reduction in 2026, is that correct?
That's correct.
Okay. All right, questions or thoughts from the committee? We have a long list here of things that we need to decide on, but that would be something that would be changing what is currently on this list. When I say list, I mean the 9B summary sheet. All right, do we need to start discussion then on what things we think? I mean, we don't have to make a motion right now, but we could have some discussion on their on HHS's recommendations for what things are included on referendum. That'd be helpful. Just wanna, I know this is a lot of information, but we're gonna have to make some sort of decisions here.
Madam Chair, I would make a motion just to get us going, that we accept both the recommendation for referendum list as well as the itemized list for reductions with the exemption of the CST line.
Okay, and that was, remind me again, because I'm struggling to go back and forth. If we remove the CST, that's how much? 12,000?
Yep, per year.
Okay. All right, sorry. I probably shouldn't have asked that before asking for a second. So we have a motion to accept this list of referendum items as well as the itemized list of budget reductions with the exception of removing the CST reduction. Do I have a second?
I'll second.
Dr. Barris seconds. Discussion?
Would we still have this, the programming, the CST programming?
Yeah, so we would then, with the reduction from this Veteran Services Office, we would be able to keep the coordinated service team individual in our budget.
Other questions or discussion? Are we ready to vote on that? Okay. So we have a motion before us. Could we read that motion one more time, please?
The motion was to accept the list of referendum items as well as the list of itemized levy reduction options with the exclusion of the CST services team programming.
All right. All those in favor of this motion, please say aye. Aye. Opposed, say no. Okay, so before we go back to our previous discussion, could we then have a total of what we have for current budget levy reductions with those two motions? I don't know. That's kind of asking on the fly here, but
So what I did
I don't know if I did this right, hopefully. So I added to our spreadsheet, I added her reductions,
Mhm.
right? Is the two and then the two small amounts and then the Ben spec. And then I subtracted the 12,000. Is that right? Okay.
So currently, we hadn't made a decision on her other 4 recommendations. The only one that we had from the VSO
Okay.
was the part-time benefits.
So just the 22,
Correct.
738. Okay.
So that's why I'm wanting to get that number before we go back to the
Yep.
discussion.
Yep. Let me.
Madam Chair, Supervisor Severson and I are lamenting that we have to leave soon. Is there anything we could take while we're getting this
Yeah,
done?
so I'm assuming I think we have some action items. What time do you guys need to leave?
I have to work night shift tonight, so I have to be up at 5 o'clock, be on the road at 6 to be to Viroqua at 7.
See, we have,
To work until 7 in the morning, so I want some sleep.
yeah, we won't have quorum after you guys leave, I don't think. So, all right, let's move to so there were consent items, agenda items number 13 through 15 were just consent. That was information only, so unless anyone had questions, we would need to approve. We've got a long list of contracts, and I don't suppose can those be moved to, they have to be approved this? Okay. All right, so let's bring those up then. That'll be 16, all the 16s. Yes. So Angie, would you like to, are you going to speak on these contracts? Thank you. No, that's all right. We're moving things around here on the agenda.
And after that, we can go back to, I have the numbers.
Okay.
It's fine.
Okay, so you want to start 16A is the amended contracts for 2022. Is that what you're thinking to go to?
Yes.
Okay. So the first one is Northwest Counseling and Guidance Clinic. We're looking for a $10,000 increase. It's largely because of crisis services that we need for individuals here and behavioral health unit. So it would be an amendment to that 2022 contract that I get out right away.
Okay, we need a motion to approve that.
Move for approval.
All right, we have a motion and a second. Any discussion? All those in favor, please say aye. Aye. Opposed?
And then the second half of that page is for 2022. We have 2 actually new providers. Haley Schneider, we were not able to get her on board this year. So we have Family Services of Northeast Wisconsin for $35,000. That's a placement for a child in Green Bay area. And then You Are Enough Counseling for $49,500. CCS consumers will be receiving counseling and therapy through our behavioral health services through her. So we've got those 2 new contracts for 2022.
All right. Need a motion
Move for approval.
and a second? Discussion? All those in favor, please say aye. Aye. Opposed? Okay, I take this to C. No, B.
B is revenue contracts for 2023. So this is something that we go through every year and actually has to go on to county board. So that's why that's important to get that done here. So then we can start signing contracts for revenue receipts for 2023 from all these providers. So
Was there anything of note in this that you think needs to be explained?
probably the biggest one is Department of Administration, about 4 down for
Yes,
the
I saw
WEAP
that.
program. Yeah, we're no longer administering that program. There's been lots of publicity around town for the new provider. So the service is being offered, just not through our department anymore.
Okay. All right, any questions? Otherwise, we'll need a motion to send this on to county board.
What was the reduction for inclusive?
There's less home delivered meals being provided to them. I would say is the biggest reason people don't like the frozen meals and they prefer to get them something else. So they're not utilizing our service anymore.
And I would probably point out the ARPA funding that we lost, obviously, from public health emergency preparedness, going from 417,000 down to 214,000. That's why the bottom numbers are really largely skewed.
And then also to the Richland Center School District that contributes towards our one counselor. They only pay for her during the school year. And originally it had been the whole year that we were invoicing out for that.
That's the bottom line.
Bottom
Okay.
line.
All right. Do I have a motion to send this on to county board? Motion by Mr. Gotchall, second. Second by Dr. Barris. All those in favor, please say aye.
Aye.
Aye. Opposed? Okay, moving on to 16C.
So these are 2023 contracts over $50,000. Again, these would all have to go on to county board. These are largely going, I mean, the list is long. I don't know. Some years we go through the whole list. I don't think we want to do that this year. Is there any questions? There's a lot of the same
I guess
activity.
if there's anything that just really changed a lot. I had tried to take a look through all of them.
Not really. Of course, the amount expended, that column that has the asterisk by it, is just for expended in 2022 as of today. Just a couple days ago, I did that. So those numbers might seem low, but know that they are also usually 2 months behind in billing us. So we still will have more accurate, reflective numbers in probably February of next year of what's actually expended from these providers.
Okay,
Plus, they're pretty similar.
motion for approval.
So moved.
Mr. Gotchall, second. Mr. Brathwaite. All those in favor, please say aye.
Aye.
Aye. Opposed? Okay, that takes us to D.
Which the rest of them, if you want, can wait. They do not need to go to county board, so we can postpone those for next month if you'd like.
Thank you. That would be, I think we do need to do number 17, it looks like. So, and then we'll go back to that. So we'll do numbers 17 and 18. How about numbers 19 through 21? Do those need to be approved this month?
It would be helpful so they can actually meet one more time in 2022.
Okay. Well, then, how about we go back to our veterans discussion? You were coming up with the numbers. Stephanie, what did you get?
So what I did is I just, for 2024, there really is no change, right? Because we're doing the Ben spec 25, right? So our total would stay the same with a $39,389.32 overage. So then what I did is in 2025, I put the Ben spec in there of a reduction of 22,738.64. So the overage for 2025 would be $126,002.90. And then in 2026, which is when we would take out the $12,000, keep the 22,000 in for the Ben spec. He's checking me. That would make our overage $122,291.71. And then finally, the last number. So for 2027, then with the $12,000 out, so we can keep treatment court, and then putting in the Ben spec, the overage is $13,408.49.
Okay, so what is our
So we're
total
still
then
okay.
for budget?
We still would, our total would be $1,017,408.49.
Okay, so we're still over the
Over
the ask.
requirement of
Okay, so I
$1,000,004.
think I need do I need a motion to bring that back, or do we just go back to it?
Need to bring it back on the floor.
Okay, so we need a motion to bring back that.
Motion to take it off the table.
Yeah,
Yeah,
I would move.
okay. All right, we have a motion and a second. All those in favor, please say aye.
Aye.
Aye. Okay, so we're going back to discussing 9F. We're looking at the discontinuation of the cemetery flag holders, the elimination of the decrease the commission per diem, decrease commission mileage, and cancel ETK computer program. Remind me where we landed. Did we have, we still had a motion on the floor, correct?
There was a motion on the floor to keep the ETK and the cemetery markers and eliminate the other two.
Okay.
And then the one, of course, was to be, I put it forward to be offered for the referendum.
But we would be, the motion is to
But
eliminate.
the motion is to
Okay.
just to fund it flat out.
All right, so discussion, does everyone understand what we're looking at here? Okay, do we need to have some more discussion on that? You ready to vote? Okay. So one more time. Could you read the motion for us? If you even understand.
I had the motion to remove the ETK program and the flag holders from consideration. And what was the second part?
So the second part would be then to accept the other two reductions, the decreased commission per diem and the decreased commission mileage, and forward that on to finance.
Okay.
Okay. All right, so all those in favor of that motion, please say aye.
Aye.
Opposed? Okay, that motion carries. That brings us back then to items number 17, approve the 2023 vehicle lease agreement and memorandum of understanding.
That one can wait, sorry, that's okay. That one can wait till next month.
Okay, great.
It's the
How about
next one.
18.
That one we have to have.
All right,
Yes.
approve the application and acceptance of the 2023 85.21 specialized transportation grant.
So this grant we apply for every year. We get it through DOT. Richland County's designation for the transportation program is within the EDRC. So this went through TCC yesterday. That's our Transportation Coordinating Committee. So we are asking for approval to move forward with applying for this grant again this year. The amount of match is 20%. Which the funding is not going up, it's not changing. It'll be a total of $79,889 with a county required match of $15,978.
Thank you. Yeah, we do this every year. It's a good thing. Can I have a motion for approval of?
I'll move.
Dr. Barris moves in a second.
Second.
Second by Mr. Severson. All those in favor, please say aye.
Aye.
Aye. Any opposed? Okay, that takes us then to the items number 19.
So we could do 19, 20, and 21. I think we could probably do all three of them together.
Okay,
So
great.
these are 3 advisory committee meetings or committees that we have. It is just really updating membership information and having that passed on for the administrative review and county board approval. We also do want to note with the Nutrition Advisory Council that we will be giving a certificate of appreciation to Donald and Susan Roseberry due to their years of service and commitment to the Nutrition Advisory Council, Older Americans Act, and the Senior Nutrition Program.
All right, so you should have in your packets those items 19, 20, and 21 that have the list of members on them. Are there any questions from the committee? If not, then I'll take a motion to approve all 3 of those.
Move for approval.
Motion by Mr. Severson. Do I have a second? Mr. Van Landewit. Any discussion? All those in favor, please say aye. Opposed? Okay. I think the rest of the items that we have, while I would like to hear them, we will postpone the discussion until next. That would include the budget summary for the VSO, our admin report, the monthly visitor log report. We'll postpone that till next month. So if you could include that again for next month. The other items in the contracts that we mentioned, and then our admin report from Director Clements. Personnel updates, we don't need to make a motion on any of those. So I think that's just informational. You guys can look at that.
What was the reason for the treatment court?
Yes, I did kind of have that question. Thank you, Mr. Sears.
Tiffany Olson took a job with the hospital, so we'll be working there and is leaving our department.
Are we looking to fill that?
We did interviews last night, so we will be looking to fill that position.
Thank you. All right, so that takes us to item number 24, future agenda items. Does anyone have agenda items that they would like to see besides the ones that we've already discussed will be included next month? No? Mr. Langrick, did we cover? It was a lot and we went back and forth. Did we cover what we needed to as far as our budget levy reductions and where we're forwarding them and all of those to the best of your knowledge?
For your responses back to finance and personnel, yes, to the best of my knowledge.
Okay, great. We did it. Thank you. Okay, that moves us to 25, adjournment. Do I have a motion for adjournment?
Before we do that,
Yes.
may I summarize?
Sure.
We have been in a position last time, this time, and probably for the next few times to determine our budgets, and we've been hurting. And I want to remind everyone, we've got an election coming up, and the state is sitting on $5.2 billion. That was reported by WRCO yesterday. And we all need to remember who's representing us and what they're going to do with that money, because we are not the only county that's having these problems. There are 72 of us. And if we got these people to move and to give that money up to those that need it, that would be us. I think we'd be well ahead. So consider your votes coming up. Who really represents you, who's doing the best thing with your money, and vote accordingly. So thank you.
There's always, we can include the public comment portion on our agenda. Okay. That's what I was gonna just comment. So our motion for adjournment would be to November 10th at 9:30 here in this room.
I got vacation day that day, so.
All right, do I have a motion? Okay. Second?
Second.
All right, all those in favor, please say aye. All right, thank you again, everyone, for coming, for sticking through that discussion. We